The World Diabetes Foundation has been in existence since 2002 to improve access to prevention and care for diabetes in the developing countries, and to be able to address the needs of the most vulnerable people with diabetes who are in greatest need for this kind of help. We have funded over 550 projects in 110 countries, of which almost 230 projects are active even now. And we work with a very small team. So we are a highly efficient organization from that perspective.
The burden of diabetes in developing countries is much higher because of the increase in the socio-economic status of the population. There is a rapid urbanization which is taking place. So the level of activity is going down. The eating pattern of the food has changed. People are putting on a lot of weight. The health system was not geared towards making a diagnosis. You might be having people who had the disease but were not being diagnosed.
There has been a lack of focus on some of the very simple things that are extremely harmful or dangerous for people with diabetes. For example, the diabetic foot. Then the other area that we have paid a lot of attention to is prevention of blindness because of diabetes. Women getting diabetes during pregnancy, addressing the issue of children with type 1 diabetes. The other area that we have addressed is the link between diabetes and tuberculosis.
If you want a sustainable program, you need to work with, in the developing world, it is the government and it is the Ministry of Health. Otherwise, as soon as your funding ends, your program ends.
We fund projects based on the needs from the country. Where people apply, we transfer money in tranches based on clearly defined outcomes. And as a consequence of that, in several countries, we have been able to move the agenda of funding small grassroots initiatives, which have now transformed into large national programs. By our funding, we are leveraging existing health systems, being a catalyst for change.
In Guinea, we have about 130,000 people living with diabetes. Unfortunately, 7% to 10 do not know they had diabetes. So the situation is not so good, but it's improving.
Je connais beaucoup de diabétiques. J'ai des amis, j'ai des gens qui avaient le diabète il y a plus de 10 ans, mais que je ne connais pas cela. C'est des amis. Mais dès que j'ai dit maintenant que j'ai le diabète, ils sont aussi dénoncés. Je connais un peu de symptômes et je sais quelles sont les précautions à prendre. Le plus grand défi d'être diabétique, c'est de l'accepter et savoir vivre avec cette maladie-là.
Professor Naby Baldé is actually the first endocrinologist that came back from France into Guinea. He formed the Foundation for Diabetes and Non-Communicable Diseases. He had first funding from the World Diabetes Foundation in 2008.
We managed to put in place the first service in Conakry. That was the starting point of collaboration with World Diabetes Foundation. We managed to put 10 clinics specialized on diabetes around the country, across the country, and after that we were able to collaborate to improve the quality and the access of care for children living with diabetes. In the current project, we are trying to improve prevention of complication and quality of care, and we are seeing an improvement on awareness in general population. Government are progressively taking care of diabetes and NCD.
Ce centre de santé, le service d'endocrinologie, diabétologie, disons, ça a beaucoup aidé, ça a décentralisé l'offre de soins pour les enfants diabétiques. Et en plus du suivi des enfants diabétiques, il y a les diabétiques de l'environnement qui viennent pour leur suivi des routines, qui étaient obligés auparavant d'aller jusqu'à l'hôpital national donc pour avoir leur suivi des routines.
This is a typical project for WDF, where we start building capacity in the capital city and letting the capacity expand into the regions. Naby Baldé has shown that it is actually possible to build capacity in a country that has been hit by many different challenges, the Ebola crisis and a lot of political instability. And at the same time, he has achieved a quite high level of diabetes services.
Tous les bilans que je fais ici, là, le cœur, les œufs, le sang, tout ça là, ça me coûte 320 000 francs. Pendant que si je fais ça, on a un dans les différents services, ophtalmo, cardio, diabéto, ça peut dépasser ça. S'il y a des examens, je peux dépenser jusqu'à 800 000, 700 000, tout au complet. Le coût est abordable. Et je fais tout sur place, pas de déplacement. Parce que ce que je fais là, si on me dit de faire ça dans les différents services, je ne peux pas faire en un jour. Je me sens bien avec le service. Je n'ai pas de problème. En tout cas, les consultations, tout ce qui se passe ici, à mon niveau, il n'y a pas de problème. Ça me réconforte.
WDF helped us with the experience, with the knowledge. We got support at each step of the project, from the beginning to final evaluation. We were able to take advantage of a lot of experience WDF got from the other developing countries. We hope to continue improving the quality of care in diabetes center in my country.